Ever really stop and think about your shoulder? I mean, reaching for that top shelf, throwing a ball, or even just, shrugging.
This is an incredible amount.
Right. And that huge range of motion, it all comes down to this really cleverly designed joint. So, welcome to the deep dive.
Glad to be here.
Today we're digging into the anatomy of the shoulder joint. We've looked at some detailed sources covering the muscles, the movements, the clinical side too.
Yep. Quite comprehensive stuff.
And our mission really is to pull out the most crucial and kind of fascinating bits about how this powerhouse joint actually works, to give you a clearer picture.
Absolutely. And what's really striking, right off the bat, is the shoulder joint's designed for mobility. The glenohumeral joint, technically speaking.
Glenohumeral, right.
Think of like a golf ball sitting on a very shallow tee. That's basically the head of your upper arm bone, the humerus, fitting into the glenoid cavity of your shoulder blade, the scapula.
That shallow socket is the key then for all that movement.
Exactly. It allows for that incredible freedom. But, like you might guess, that much mobility needs support.
There's the trade-off.
Precisely. So you have the joint capsule, various ligaments, and really importantly, a whole team of muscles working dynamically.
Okay, let's get into that muscle team because, the sheer number of ways your shoulder can move, it's definitely not a one muscle job.
Not at all.
Our sources really emphasize the rotator cuff muscles. People hear that term a lot, often with injuries, sadly. The SSUs muscles.
It's a handy acronym for the four main ones: Supraspinatus, Infraspinatus, Teres Minor, and Subscapularis.
Okay, SITS. So what are they actually doing? Why are they so critical?
What's cool is how they coordinate. The Supraspinatus, it sort of kicks off lifting your arm out to the side, that's abduction.
Okay, the first little bit of the lift.
Exactly. Then the Infraspinatus and Teres Minor, they work together for external rotation, turning your arm outwards.
Like winding up for a throw?
Sort of, yeah. And the Subscapularis, that handles the opposite. Internal rotation, turning the arm inwards.
Okay.
But maybe their most vital role isn't just those individual movements. It's how they stabilize the whole thing. They keep that humeral head centered in the shallow glenoid socket.
So they're constantly making tiny adjustments.
Constantly, like guide wires, keeping the ball on the tee while you're moving your arm all over the place. Without that, the shoulder would just pop out, basically. It'd be way too unstable.
Right. So they're the stability crew, allowing the bigger muscles to generate the force.
You got it.
Speaking of bigger muscles, the deltoid. That's the one everyone kind of sees, right? The cap of the shoulder. What's its role?
The deltoid's a major player. It's actually got three parts, or heads. The middle part is the main muscle for abduction, taking over from the supraspinatus to lift the arm higher.
Okay, so supraspinatus starts it, deltoid finishes it.
Pretty much, for abduction anyway. Then the front part, the anterior fibers. They help with flexion, bringing your arm forward.
Like reaching out in front of you.
Yep. And the back part, the posterior fibers, they help with extension, moving your arm backwards. So it's really versatile, a true powerhouse for a lot of different movements.
It's amazing how specialized yet coordinated they are. Now, the sources also brought up the pectoralis major. We usually think of that as a chest muscle.
It is, primarily. But it attaches to the humerus, the upper arm bone. So it has a big impact on the shoulder.
How so?
It's a strong mover for flexion, especially bringing your arm across your body. Also adduction, pulling your arm towards your body's midline, and internal rotation too.
Okay, so think like a bench press motion or swinging a bat.
Exactly. The pec major is heavily involved there.
Gotcha. And then there are the latissimus dorsi and teres major.
Yeah.
Often mentioned together. What's their contribution?
Right. The lats, that huge muscle covering a lot of your back, and it's sort of a little helper, the teres major, they're key for pulling motions.
Pulling down or back?
Both, really. They're powerful extensors, bringing the arm behind you. They also adduct, pulling the arm in, and internally rotate it. Think swimming or doing a pull-up.
Okay, so they counterbalance the forward movements from muscles like the pec major and anterior deltoid.
In a way, yes. They work antagonistically, but also synergistically, depending on the overall movement. It's complex.
It really is becoming clear just how interconnected this all is. But the info, we have also mentioned the trapezius and serratus anterior. Now, these aren't directly crossing the shoulder joint itself, are they?
No, not the glenohumeral joint.
Yeah.
But their role is absolutely essential. This is where you see the importance of the whole shoulder girdle working together.
Okay, tell me more.
The trapezius, or traps, and the serratus anterior mainly control the scapula. the shoulder blade. And how that scapula moves is critical for full arm movement.
How so? Like, how does moving the shoulder blade help the arm?
Well, take the serratus anterior. It helps pull the scapula forward and also rotates it upwards. That upward rotation is physically necessary to lift your arm all the way overhead.
Ah, so the socket itself tilts upwards.
Exactly. It repositions the glenoid cavity. And the trapezius helps control and stabilize the scapula during pretty much all arm movements. Without this smooth, coordinated movement of the scapula on the rib cage, we call it scapulothoracic rhythm.
Scapulothoracic rhythm. Okay.
The glenohumeral joint just couldn't reach its full range of motion. It's a beautiful partnership.
Wow. So it's not just the ball and the socket, it's the whole foundation moving intelligently, too.
Incredible. Okay, let's quickly list the main movements again. Flexion, extension,
Abduction, adduction,
internal and external rotation.
and circumduction, that's making circles.
Right. And just to reiterate, these are all a result of both the glenohumeral joint and that scapulothoracic movement working together.
Absolutely. It's a combined effort for almost every significant shoulder movement.
Okay. Now, this amazing design, all this mobility, it seems like it would also make it somewhat vulnerable, right?
That's the downside, yes.
Our sources really hammered home the clinical relevance. Why is understanding all this anatomy so critical, especially for, say, physios or trainers? Because things do go wrong. That high mobility and constant use make it prone to injury. Rotator cuff problems, tears, tendinitis are incredibly common.
You see that a lot in sports, overhead throwing.
Yep, and also just with age, wear and tear on those SSAT muscles.
Yeah.
Then there's frozen shoulder or adhesive capsulitis.
Ooh, that sounds unpleasant.
It is. The joint capsule itself gets thick and tight, severely restricting movement. Very painful, very stiff.
Okay. Wow.
Impingement syndrome is another big one.
Yeah.
That's often when those rotator cuff tendons, usually the supraspinatus, get pinched under the acromine, that bony arch on top of the shoulder.
Ouch. Causes inflammation.
Yeah, inflammation, pain, especially when lifting the arm, and dislocations, of course. The ball literally comes out of the socket.
Which way does it usually go?
Most commonly anteriorly, so forwards and downwards. Usually from some kind of trauma, like a fall or a direct hit. It really shows how that shallow socket, great for movement, isn't inherently super stable on its own.
It definitely highlights the importance of those muscles.
Mm-hmm.
So knowing all this anatomy, how does it actually help, practically speaking, in treatment or rehab?
Oh, it's fundamental. You're doing manual therapy. You need to know exactly which muscle you're working on, its attachments, its function to be effective.
Makes sense. Targeted treatment.
Exactly. And for designing exercise programs, whether for rehab after injury or just for general strength and conditioning, understanding which muscles perform which actions lets you choose the right exercises.
To strengthen weaknesses or restore balance.
Precisely. You can target specific parts of the rotator cuff or work on scapular stability with the traps and serratus anterior. It guides the whole process, ensuring you progress safely and effectively to get back full function, strength, stability. You simply can't fix it well if you don't understand how it's built.
It really drives home the point. Okay, so let's try and wrap this up. We've explored the shoulder joint, this amazing ball and socket, the glenohumeral joint, giving us incredible mobility.
The most mobile joint in the body.
We met the key muscle groups, the stabilizing rotator cuff, the powerful deltoid, helpers like the pec major and lats.
And crucially, the scapular movers, the traps and serratus anterior.
Right, orchestrating that scapulothoracic rhythm, essential for full movement. We looked at the main actions, flexion, extension, abduction, and all the rest.
And saw how they're a combination of joint and scapular motion.
And finally, we touched on why this knowledge is so critical clinically understanding common issues like rotator cuff tears, frozen shoulder, impingement, dislocations.
And how anatomy guides effective treatment and rehab.
It really is a marvel of biological engineering.
It truly is. And maybe the biggest thing to take away is just that incredible balance it strikes between being so incredibly mobile, yet stable enough for everyday tasks and powerful actions. You know, how does this relatively unstable bony setup, managed by this complex muscle network, actually pull it off? It makes you wonder, what happens when just one small part of that intricate system isn't quite working right? What subtle compensations might your body be making right now, and what could that mean down the line?
That's definitely something to think about, the ripple effects within such a complex system.